Tá no ar o Fuecast, o maior podcast de transplante capilar do Brasil, diretamente do World Fui. Hoje, infelizmente, já é o segundo dia, já está quase acabando esse evento maravilhoso, mas, independente de qualquer coisa, estamos trazendo ainda as maiores referências do mundo. E hoje aqui com a gente, ninguém menos que o maior especialista do mundo em um assunto que a gente já trouxe para vocês, que a gente é muito fã, que é de câmera hiperbárica. Dr. Maxim, um excepcional cirurgião capilar e também um dos maiores especialistas aí no assunto. Seja muito bem-vindo, Dr. Flávio até falou de você no último episódio que a gente gravou junto.
Sorry. All right, you can take off now. Okay. Just stay there and just talk.
Okay, so we're going to discuss the topic of using hyperbaric medicine in combination with hair restoration surgery. I think it's one of these topics that why I didn't think about this before. Okay, and when you look into how HBOT works, it completely makes sense. Okay, everything about hyperbaric medicine, it's a perfect solution to address potential problems that we encounter with hair restoration surgery. And I can bring them down to a few categories. Okay, one, we think it does help to prevent ischemia reperfusion injury. And what is ischemia reperfusion injury? It's basically if you take a live tissue and you expose it to anoxic environment, you have accumulation of reactive oxygen species, byproducts of anaerobic metabolism, which will actually hurt the grafts, hurt the results. Okay, so when you place your grafts back into the oxygenated environment, what happens? You have accumulation of these anaerobic metabolites, and which will attract your immune system to attack the tissue, and that could encounter some time why we have not perfect results or failed hair restoration surgeries. So it is proven in many articles on PubMed shows how with proper protocol we can mitigate ischemia reperfusion injury of the grafts. Okay. Number two is the fact that we expose our tissue to highly inflammatory conditions. Any manipulation of the scalp or the donor area can result, and some people can have a more robust inflammatory response. And it is very important to prevent excessive effusion, excessive edema of the especially recipient area. And in my lecture yesterday, I show how you can see through diffusion, through calculation of diffusion rate, the higher the distance, the lower the rate and of the oxygen delivery. And logically, you want to provide to recently placed grafts as much oxygen as possible, especially during the first 7 days. We know that it takes about 7 to 10 days for neovascularization to happen and to have a direct blood supply to your grafted tissue. So how do we support graft this first 7 days? I think hyperbaric oxygen therapy is a perfect solution because it doesn't depend on the blood carrying capacity of hemoglobin. You can bypass all that and you supply oxygen directly to the grafted tissue, which is absolutely essential, right? Then, what other problems we can encounter? Potential risk of donor area, recipient area necrosis, and it happens because of, especially with proliferation of black market clinics. And I saw at least 5 patients in my practice who came from one of these places with necrosis of the recipient zone. And HBOT does exactly what it's supposed to do. It bypasses the system. It relieves the ischemia, anoxia of the recipient or donor area, and help to either prevent it or treat it. And then, of course, infection. it's rare, but it's one of those things that we don't want to see in our practice, right? HBOT has both direct anaerobic and bacteria. It has direct bactericidal and bacteriostatic activity. So it is bactericidal against anaerobic bacteria, bacteriostatic against aerobic bacteria. It does increase the oxygen burst of the neutrophils, so it helps to with antibiotic treatment, it helps to prevent infection as well.
Perfeito.
Right. I have a question.
Can put.
You can put it. Dr. Maxim, a gente já sabe que vocês têm um projeto, um estudo multicêntrico. Você, Flávio Giardello, também faz parte desse estudo, que envolve a hiperbárica aplicada ao transplante capilar, né? Você acredita que é possível atingir uma pressão capaz de bloquear o shedding pós-operatório?
Não consegui ouvir?
You can't hear?
You didn't hear?
No.
No? He didn't hear.
Oh, 1 minute. Please.
Okay.
Repete a pergunta, por favor.
I'm going to repeat the question.
Daí
Okay?
que eu tento arrumar.
I'm going to ask again.
Ok.
Dr. Maxim, você acredita?
Now I can hear.
You can hear?
You can go there.
Yeah?
Go there,
Yes, I
please.
can hear now.
Ok,
Here?
ok.
Ok.
Yes, I can hear you perfect now. Yes.
Nós estamos sabendo que você está desenvolvendo um estudo multicêntrico. Flávio Giardello, nosso amigo brasileiro, cirurgião hiperbarista, também está envolvido, que aplica hiperbárica ao transplante capilar. E você acredita que é possível atingir uma pressão da hiperbárica capaz de bloquear o shedding pós-operatório?
Yes, this is a great question, and this is one of the most enthusiastically addressed topic by me. Okay, because it could be potentially create revolutionary changes in hair restoration. Why it is important? You know, we all know that it takes between 6 to 12 months to see the final result. What if we can develop a protocol that will eliminate postoperative shedding completely and have an immediate result? And we can call in settings of unshaven FUE, which we call the preview long hair FUE.
Yes.
And the reason why we call the preview, because you pretty much lose all this hair
Yeah.
in a few months. So yes,
Yeah.
I mean you can show potentially to a patient how you're gonna look like, but I bet some of them are having a little bit of mixed feelings losing this hair.
Yeah.
So what if we can eliminate this word preview from the long hair FUE and have a real
Long hair.
hair FUE? So something that what I notice and in my practice, and I have about more than 30 patients who completed high intensity HBOT protocol, we were able to eliminate postoperative shedding almost completely. So I have a case study with 30 patients that received their results between 4 to 5 months postoperatively, which is and they appear to be like a final result what you expect to see at 12 months. I can share a little bit of the protocol that I use. So what I found the most important is to have treatments before the surgery. It is called preconditional treatment.
What kind of treatment?
Yes.
Okay, sorry.
Yes, the hyperbaric treatment.
Okay.
Yes. So we're talking about hyperbaric
section.
Yeah. So my patients arrive in the clinic at 5:30 a.m. and we start the day with hyperbaric treatment. My treatments are scheduled with 60 minutes exposure to high pressure oxygen, and we talk about 2.5 atmosphere. Okay?
2.5?
2.5. So
Oh,
this
a lot of
seemed to
pressure.
be...
Yes, it's a lot.
Why did they choose...
I think now I prescribe it at 1.4.
1.4. In
Yes,
Brazil,
yes.
it's 1.5.
Yes.
1.5.
So, what I found by researching PubMed and articles, I think most of the reasons behind postoperative shedding is ischemia reperfusion injury. And I explained in the beginning of our conversation what happens with ischemia reperfusion. If you can completely mitigate all the damage being produced by products of anaerobic metabolism, that's what actually happens. That's why we don't see postoperative shedding. And you can only achieve it with high pressure, 2.5 atmosphere. So you have to use a medical grade hyperbaric chamber. There are not too many manufacturers that make this type of chamber. So this is what you see in the hospitals. These chambers are capable of producing 388, 3 atmosphere pressure. So these protocols allow me to get them to 2.5 atmosphere, 20 minutes air break for 3 minutes, and total of 60 minutes exposure.
Okay.
16 minutes.
Yes.
And after that, you go to the room surgery and start,
Yes.
right? Okay. Do you use some different gravity hold solution inside the surgery or something else?
Yes, so something I've been experimenting recently. So I like to use a PPP or plated poor plasma holding solution in addition with ATP, liposomal ATP that
In
we
Brazil,
have
we don't
commercially.
have.
PRP?
Oh,
No,
You do not?
ATP.
HTP?
Yes.
Ah, oh, I know.
And I developed my own cooling system that I might share the picture later. So it's basically I have a refrigerator that circulates a coolant at 8 degrees Celsius. And I built aluminum plates, and the solution circulates continuously, preserving 8 degrees Celsius throughout the entire procedure.
Here I have a question. I heard in a congress that I have gone, a doctor who told me that eu vou falar em português para a audiência, tá? Em vez dele resfriar a solução de armazenamento dos folículos, ele aquece. E segundo ele, eu fui a um congresso recentemente que um colega falou que conheceu um outro médico que disse ter bons resultados ao invés de resfriar a solução de armazenamento, eu acho que utiliza soro fisiológico, ele aquece na temperatura corporal e tem excelentes resultados.
37 degrees.
Você acha que faz sentido? Então, eu gosto quando a pessoa me leva ao questionamento, porque, segundo ele, a filosofia dele, a gente não faz isso de maneira assertiva, esse resfriamento, esse tempo. Quando tira esse processo até resfriar e depois o processo de voltar a uma temperatura normal para depois poder fazer a implantação. Você concorda, discorda? Qual a sua visão?
It's very interesting approach, obviously very unorthodox, and I mean, I think more studies need to be done just to compare and making sure it's safe. From the logical perspective, with the anoxia that the tissue is being subjected, it makes sense to slow down the metabolism, and that's what cooling does. More probably studies would help to determine which temperature is the most comfortable for the grafts. Obviously, I think going to 4 degrees Celsius is a little bit too excessive, but 8 to 10 degrees Celsius, it's enough chilling, but without subjecting the tissue to, the frost injury or something like that.
E vamos... Quer falar sobre o necrose, que eu acho que é o maior medo de quem faz o transplante capilar? Eu acho que o maior medo de todo mundo que faz, de fato, o transplante capilar é ter as complicações de pós-operatório. A gente já citou aqui vários, mas, por exemplo, frente a um caso de isquemia identificada precoce, exemplo, eu acabei de fazer minhas pré-incisões, se for o caso, e notei que tem uma área que está ficando ali um pouco hipocrômica, uma palidez. Exato. Qual que é o protocolo que você sugere para... vamos partir do princípio que uma necrose já estabelecida, tá? E também uma necrose de início, de diagnóstico de início ali precoce.
Yes. So the reason why it has to be a physician-led procedures is exactly for that reason. When you take a physician from the equation, from the evaluation of the patient, that's what you're looking for potential complications such as necrosis of the recipient or donor area. So I start with identifying the risk factors that can predispose people to necrosis. And the first one, and of course, a history of smoking. History of smoking produces continuous vasoconstriction and damage to the microvasculature. History of diabetes. This is another reason. History of peripheral vascular disease, different etiologies also predispose our patients to necrosis. So these factors need to be identified during physical examination. That is essential step before you take the patient. So most of the time we see these cases from patients who went into a gray market or black market clinic without proper evaluation. And this, at least in my practice, all 5 cases that I were referred to me, that was a very similar story. Going somewhere across the Atlantic Ocean and coming back with necrosis of the recipient zone.
This case is the worst that I ever seen.
Yes.
So this one, what we can do?
So in this case,
Pray.
Yeah.
Pray kill someone who did this.
So in this case, it's a little bit too late to do anything. So when we see early signs would be small dark areas of inflammation, swelling. If you suspect, you need to refer this patient to hyperbaric therapy as quickly as possible.
Yeah.
Because you can limit the expansion of the recipient area necrosis if you act quickly. Of course, you can prescribe nitroglycerin paste. When you show this type of recipient, it's absolutely disaster.
Yes.
I think this patient will need many plastic surgery procedures with skin grafting and flaps and.
I have here the evaluation. The worst that
Dr.
I've ever
Maxim.
seen.
Todo ano a gente vê novidades nas suas apresentações relacionadas à hiperbárica e transplante capilar. Quais as dicas que você daria para quem está iniciando no transplante capilar em relação à rotina de se realizar hiperbárica também? Qual a tua orientação para quem ainda não aplica a hiperbárica na tua rotina de transplante capilar?
Como começar, né? How to start? To implement.
Yes, so it's a really good question. Implementation or installation of hyperbaric chamber in your practice is not always feasible for everybody. There could be financial constraints. There could be physical availability of the physical space. It takes a lot of square footage from yes. So and it is a big investment. But the idea of if we have an option to mitigate potential complications, to provide the best possible results, and if you remember from my initial introduction, hyperbaric pretty much addressed every single concern that I have as a hair transplant surgeon. So I would definitely implement, and the reason why I'm so enthusiastic about presenting these topics in different events throughout, I've been in India just 2 weeks ago, and I was talking about hyperbaric chamber. I was in Monaco, I was talking about hyperbaric chamber. My last meeting in Denver with ISHRS was hyperbaric, because I want more and more doctors to realize how much potential we have with HBOT, because what we have to care, it's the patients, it's the patient care, and before we start to assume what is our revenue will get, right? We need to think about the patient, providing the most successful outcomes for the surgery.
Perfect.
And this is one of those modalities that can definitely.
Estamos aqui caminhando para o final. Eu não posso deixar de agradecer você por trazer tanto conhecimento aqui para a gente e, de fato, agregar tanto a prática médica. Assim, nós três aqui, eu digo em nome do grupo até, nós já somos entusiastas desse tema. É algo que é difícil de você encontrar um especialista que de fato faz isso e faz estudos sobre isso. Eu falo, quando vem falar de hiperbárica, já está a gente do lado, querendo ouvir e pegar, porque a gente realmente é fã. Eu acho que isso muda não só os nossos resultados, mas também tem que estar inserido não só para complicação, igual muita gente usava. Ele tem que usar igual os seus estudos talvez vão provar aí para a gente, se Deus quiser, o mais breve possível, para a gente implementar isso na nossa prática. Eu acho que tem muito que vir por aí, inclusive em alopécias cicatriciais. Eu acho que pode ter uma implementação aí muito grande, mas você vai trazer isso mais concreto aí para a gente. E, mais uma vez, obrigado por ter topado esse convite, por estar aqui conosco. Queria falar para o pessoal que está em casa, que não pôde estar aqui esse ano, fala para eles como que pode te encontrar nas redes sociais, acompanhar mais o seu trabalho. Se quiser falar para essa câmera aqui, ó.
Yes. Yes. So thank you so much for the opportunity to advance hyperbaric oxygen therapy. I think it's very important. And Dr. Flavio Giardello, I met him during the last ISHRS meeting in Denver. Mm-hmm. He's the same enthusiast of hyperbaric oxygen therapy, and I think we're going to structure a multi-center study to bring more solid evidence to what we do. But if you want to find me on Instagram, it's very easy. It's hairbydoctor.max. That's my account, and I frequently post about hyperbaric oxygen benefits and show patient cases and patient results using the HBO.
Oh, nice.
E o que precisar da gente para poder ajudá-lo no estudo, pode contar conosco, estamos à disposição. Todos nós aqui implementamos a nossa prática, então se precisar de mais só falar que a gente topa participar também, tá? Para vocês que estão em casa, não deixem de seguir a gente aqui no YouTube, o @fue.cast, no Instagram também, o meu pessoal, @drmauricioreis,
@dr.edgaciolio,
dr.paulomiorali.
E agradeço mais uma vez vocês e até a próxima. Muito obrigado.